Let's describe now the arteries supplying the lower limbs. So here we have all our aorta, the ascending, the aortic arch, and the descending aorta. Right about here, we have our diaphragm muscle. And remember, the diaphragm has the foramen for the aorta. So that's where the descending aorta passes through to become from thoracic. The thoracic segment becomes the abdominal aorta. Thoracic and abdominal aorta gives off multiple branches to all the organs and the wall of the thoracic and abdominal region. The thing is that the abdominal aorta branches off or ends in two terminal branches. I'm going to put it here in black. These two are the right and the left common iliac arteries. Now it's just that section before the bifurcation. Now the common carotid, common iliac artery branches into one thin iliac internal iliac artery and one thick lateral or external iliac artery. So common iliac artery branches off into internal and external iliac artery. The internal iliac artery supplies all the organs of the abdominal pelvic region. The external iliac artery is the one that we're going to follow now, the green one. So it passes, and I hope you remember this, another anatomical surface anatomy landmark. It passes under the inguinal ligament. Remember the inguinal ligament? That is that ligament between the anterior and superior iliac spine and the pubic tubercle. Okay, so let's follow that artery. I'm gonna erase this and let's go to the next image. In here, just the same. Okay, look, in here we have the abdominal aorta branching into two, the right and the left common iliac artery. So from here to here, this is the common iliac artery. CIA. Now, the common iliac artery branches off into two blood vessels, two arteries. The medial one is the internal iliac artery, and the external is the lateral is the external iliac artery. Look at the inguinal ligament from the anterior and superior iliac spine to the pubic tubercle. So this external iliac artery passes under that ligament, and becomes the femoral artery. Now, look at that, I'm mixing here. The femoral artery, same story that we described in the upper limb. Now we're going to describe, can you see, different sections of the same blood vessel, but as it goes through different body regions on the lower limb, it will receive different names, but it's the same artery. Okay, let's try to draw that. Okay, I think it's better if we understand it like that. First, you know what I'm gonna draw? Oh, come on. Okay, the first thing that I'm gonna draw are our important anatomical landmarks that we need to remember. Well, first, inguinal ligament. Started that. Okay, anterior superior iliac spine to the pubic tubercle. Then we have, remember that around here, we have the sartorius muscle, right? Crossing your thigh. And about here, well, mostly here, we can feel all of this is the adductor longus. And the adductor magnus, if you remember about here, it inserts in all the medial aspect of the femur, and then like skips these parts and then inserts into the adductor tubercle of the femur and leaves this adductor hiatus. Again, this is only a review from your lab class. all the important anatomical landmark surfaces. Another important anatomical landmark that we're going to use in here is the popliteal fossa. And I think we're good in here. Okay, let's start with, I don't know, with the abdominal aorta as it branches into the two common iliac arteries. The common iliac artery gives a little branch for the internal organs right in there. That's your um, internal iliac artery, and well, didn't help, right? And another branch, which is the external iliac artery. This external iliac artery, as it passes under the inguinal ligament, it becomes the femoral artery. And the femoral artery, now you can remember why, and maybe you say, oh, that's why she drew that. If you remember, this is the femoral triangle, which is the triangle formed by the inguinal ligament superiorly, inferiorly is the sartorius, and medially is the adductor longus. Right in there, remember, is in the femoral triangle is where we can palpate because the femoral artery, because it's very superficial in here. Now, this femoral artery keeps, descending in the anterior medial aspect of your thigh and enters, where anteriorly enters into the abductor hiatus, and it goes back. Okay, so now let's grab this artery. It's passing through that tunnel, and it gets, or it locates now here is the same artery again. The red one is the femoral artery. Now, since this artery is located on the popliteal fossa, we're going to call it popliteal artery. The popliteal artery has 3 branches, and let's put very different colors in here. One is called, let's start with the posterior tibial artery that supplies all the muscles in your posterior leg, passes posterior to your medial malleolus, another anatomical landmark, and ultimately will form the plantar arch, gives off several branches and form the plantar arch in your foot. There's one branch coming up from this posterior tibial artery, which is the lateral side, the fibular artery. Okay, that supplies the lateral muscles, the muscles of your lateral compartment in the leg. Now, the popliteal artery gives off a second branch, and let's put that in, I'm running out of colors, in red again. Okay, and this one, now we're going to point that anteriorly. Again, in green, we have the popliteal artery giving off 2 branches, the anterior in red and the posterior in purple tibial arteries. The posterior tibial artery is the one that gives off the fibular artery. Now we're going to follow in red the anterior tibial artery. But it's anterior tibial artery, and we are in the posterior surface of the leg. So now we have to go to the front. We pass through, or this artery passes through the interosseous membrane between the tibia and the fibula and becomes anterior. Okay, so here, I shouldn't choose red, but in here we have the anterior tibial artery. It descends in and irrigates all the muscles in the anterior compartment of the leg. In your foot, right in here, it becomes the dorsal pedis. This is the dorsum of your foot. Pedis is the name of the anatomical name for your foot. So it becomes the dorsal pedis artery. And it arches like that and forms the arcuate artery. And that artery, or from there, we're going to have a lot of branches, digital branches for your toes. Okay, so that's the irrigation of the lower limbs. I'm gonna erase all of this so we can go to the next slide. Okay, and let's review now again in this beautiful image. Let's review all of these blood vessels. So we have here, this is the abdominal aorta. These are the two branches, the right and the left, common iliac artery. Look at the thin internal iliac artery supplying all the organs of the abdominal pelvic organ, the abdominal pelvic cavity. And the thick external and lateral external iliac artery passes under the inguinal ligament and becomes the femoral artery. Right here, look at my blue dot. Right here, the femoral artery in the femoral triangle can be palpated. You can feel the pulse, you can poke it if you need a sample of arterial blood. Okay, now the femoral artery, look how it's located anterior medially in your thigh and passes through the adductor hiatus, the opening or the foramen left by the insertion of the adductor magnus. Now we move from anterior to posterior. We're in the back of the leg now. Actually, the back of your knee. See that this artery is not called patellar, it's called popliteal because we're in the back of your knee. So the popliteal artery, again, in this area, another blue dot. If you flex, you need to flex your leg in order to palpate this artery. It's not an easy thing to do, but you can palpate your artery, your popliteal artery in there. Now, the popliteal artery gives off two branches. Remember, anterior tibial artery and posterior tibial artery. Let's follow just for fun now. First, the anterior tibial artery. The anterior goes to the front. Look how it's passing through the interosseous membrane between the tibia and the fibula. And now we have it here, right anteriorly. Okay, it descends to the anterior aspect of the tibia and when it's in ankle, and when passing through the dorsum of your foot, we call it the dorsalis pedis artery. Okay, this one arches and form your arcuate artery, and from there we're going to have several dorsal metatarsal arteries. Done with the anterior tibial artery. Let's see the other branch. The posterior tibial artery continues in the posterior medial aspect of your thigh, of your leg, runs posterior, should remove that, but it goes posterior to the medial malleolus, and right in there you can feel the pulse of the posterior tibial artery, and eventually reaches the plant of, or the sole of your foot, and after several anastomoses, it forms a plantar arch. And from there, we're going to find metatarsals and digital arteries for your toes. Now, this posterior tibial artery gives off one important long branch, which is the fibular artery. That is a lateral artery that supplies all the lateral muscle compartments of your leg. And that's it. Let's leave it like that. Okay? We have described all the arteries, the major arteries of the lower limbs. Now, in the next video, we need to collect all of this deoxygenated blood because the arteries on the systemic circuit already, we're right there in the toes and in the fingers, in the tip of the fingers. They already have given off all the oxygen. They supply with oxygenated blood all the tissues. Now we need to collect that deoxygenated blood into veins, and we're going to follow now the opposite direction. Now we're going from distal to proximal to the heart. So we're going to form veins to collect all of this blood and send it back to the heart. See you.